bright light. What's that smell?
There's no bright light.
There's like a weird taste in my mouth.
Do you ever brush your teeth? Oh, what? What are you doing? Oh my god. Here, he's like biting himself. Put this in your mouth. Ow. Bit me. Stop. Stay still. Stop moving. You're scaring the people away. Guess I'll call 911. Hello? My husband's having a seizure, I think. We're under the bridge. Please come.
So Chris, when are you going to buy me a new box? I am so tired of living in that small, tiny box you call a home under the bridge.
Our box is fine.
No, it's not. Janice has a huge box.
Janice?
Janice!
From down the street from under par?
Yes!
Oh my gosh, our box is fine. It doesn't even leak anymore.
It's going to. We live in Florida. It storms every day.
Duct tape.
Ah.
Knock, knock. Hello. Hi. All right, my name is Jessie. Hi, Mr. and Mrs. Buford. Hello. How are you guys doing? Good.
All right.
Good. I'm here to get your discharge going. So I just wanted to make sure that you have a clear understanding of what your condition is. So do you know what you have?
Yeah, I have seizures from time to time.
Okay, so that's called epilepsy, and that is when you have abnormal electrical activity in your brain, which is what causes the muscle spasm. Does that make sense?
Yeah, yeah.
Okay. So I also just wanted to check and see how you're feeling.
I'm feeling alright now, but I feel depressed sometimes.
That's actually common with this condition, so the doctor has actually prescribed something to help you with that, all right? I'm going to go ahead and get the doctor in here, and she's going to go over all the meds with you, okay?
Okay.
All right.
You should get sick more often. Look at this. We have clean blankets, AC.
It's cold.
They've been feeding you.
3
This is
square meals
great.
a day.
Ugh. Maybe you shouldn't take your med after all. You can come back here every week.
I guess, yeah.
I mean, isn't this comfortable? More comfortable in the box?
It definitely is.
Alright, that's what we're gonna do.
Hello, Mr. Buford. I'm Dr. McLaughlin. We're going to go over your meds today that we're sending you home with, okay? First one, Depakote. This drug may cause hepatotoxicity, particularly in the first 6 months of therapy. May proceed by loss of seizure control, malaise, weakness, lethargia, anorexia, vomiting, blurred vision, diarrhea, and ringing in the ears. Next drug, Paxil. Hyponatremia, seizures have been reported, serotonin syndrome, agitation, confusion, diaphoresis, hallucinations, hyperreflexia. That only occurs rarely though, so don't worry. Aspirin, NSAIDs, warfarin may increase risk of bleeding. And your last drug is going to be Valium, and that's going to cause swelling, thrombophlebitis, carpal tunnel syndrome. Any abrupt or rapid withdrawal may result in pronounced restlessness, irritability, insomnia, hand tremors, abdominal muscle cramps, diaphoresis, vomiting, seizures. Since you already have epilepsy, it's going to be a more pronounced frequency in seizures. Overdose may result in drowsiness, confusion, diminished reflexes, CNS depression, and coma. Foods that you probably shouldn't mix with it, or definitely shouldn't mix with it. Grapefruit is going to increase the concentration and the effects. If you're going to take any herbal supplements, make sure you check with your primary physician before you do so. And just make sure you don't drink any alcohol with any of these medications. All right? It was great meeting you guys. Have a great day.
Watch out now.
Oh my, this is the closer we get to Disney World as possible.
It's a roller coaster. Got your side rails up? Don't fall out now.
So Tara must be right.
Oh, are you ready for this one?
I'll take you down.
Woo!
Knock, knock. Hello. All right, so I'm back, and this is my student nurse that's following me today. Her name is Lauren.
Hello.
So the doctor went over everything, and I'm sure you understood everything, correct?
Did I understand? I didn't understand. Did you? No, that doctor woman came in here talking about hypernatremia, hyperflexa, diaphoresis. I don't know what that means.
I'll go over all the meds again. Hypernatremia is actually the levels of sodium in your blood, and it's going to be high. So you're going to have high levels of that. Hyperflexia is when you have sudden jerky movements, like your wrist twitching. And diaphoresis, that's just profusely sweating. So I'll go ahead and go over all the meds again with you so you understand what you're taking. I understand you're frustrated. So Depakote is the first med. This is going to be decreasing your seizure activity. So if you notice any yellowish coloring of your skin, it's called jaundice, and that has to do with your liver not working properly. So if this is the case, you're going to want to give us a call so we can get you in, check you out. You also want to make sure that you're keeping up with your follow-up appointments because we have to take your blood levels to make sure that the medication is at a therapeutic dose. If you notice any severe headaches, you want to also give us a call for that as well. So do you guys understand what Depakote is for and all the reactions with it? Yeah? Okay. Paxil is a medication for your depression. So if you're feeling suicidal, you want to give us a call immediately so you can come in and we can get that checked out. If you notice that he's talking funny, you're also going to want to give us a call. So do you understand what Paxil's for and all that? Yeah? Okay. So Valium is a medication for anxiety, and it's also an anticonvulsant, which is helping with your seizures. If you start having sudden mood changes, you have slurred speech, you have trouble walking or vomiting, you want to give us a call so we can check you out. And that completes the meds. Do you understand the meds? Any questions? Okay.
All right, so I'm going to explain what to do the next time you have a seizure. I looked over in your chart from the ED, and it said that you were experiencing some bright lights. So those bright lights are an example of aura, which is describing the symptoms that you'd have before a seizure. So if you have any of these symptoms, vision changes, bright lights, slowly spreading spots, strange smells, or nausea, you're going to want to move him away from any objects, put him on the floor, don't sit on him, don't put a tuna can in his mouth again, and turn his head to the side in case he were to vomit. Does that all make sense? Yeah. Okay, and I'm going to give you this pamphlet as well with everything that I just said, just in case you forgot. All right?
Thank you.
Do you guys have any more questions? No? Okay. Sounds good. Have a good day.
Okay. That makes so much more sense than what that doctor woman said.
Hi, Mr. Buford.
Hello.
My name is Regine, and I'm the medical social worker here in the hospital. I see that you're ready for discharge, but before you leave, I want to make sure that you have all the tools you need to help you once you leave the hospital. I have some information for you. The first is on the Epilepsy Foundation of Florida, and it helps people living in Florida that are experiencing seizure disorders and epilepsy. They include a wide variety of services like medical care, prevention, education, psychological evaluations, and counseling. They also have support groups and an advocacy program that you might be interested in. Do you have any insurance?
No.
No. Okay. Well, there's another place. It's called the Health Care Center for Homeless. It's located right on North Orange Blossom Trail. Do you know where that is?
Yeah.
Okay, good. Well, they operate between the days of Monday through Friday, 8 a.m. to 5 p.m. And there you can have all your primary medical needs taken care of. They also have a referral service. If you need to see any specialist for your condition, we understand that transportation might be an issue for you. So they also have a pharmacy on the premises that you can go talk to the pharmacist, find out more about your medication. If anything that you were told today is unclear, they can go over everything with you. They even have low cost to free services as far as your medication goes. And from what I understand, you're on Paxil, Depakote, and what was the last one? Valium. Yes, those are all on our medication list. And again, they have resources for some low cost options for you, or even some free medication programs. Where are you living right now?
There's a bridge by Park Street and a box there.
It's a box near a bridge. Okay, well, the Men's Service Center, this is run by the Coalition for the Homeless. You can pay $1 a night. You just have to be there at 8:30 p.m. and there you can get a warm shower. You can even get meals. It's a safe environment for you as opposed to under the bridge. Do you have ID?
Yeah.
Okay, good, because they'll need to see your ID. That's important to have. That's good that you have that. But you can take showers, clean your clothes. They even have lockers there that you can lock up all your valuables. So even if you don't stay there, you can go there every night for dinner. They serve meals at about 7 p.m. to 7:45. They do sometimes have a waiting list, so you might want to get there early, or if you can find a way to call, and find out what their availability is. Let's see, are you working right now? No. Okay, well, another resource I want to tell you about is Goodwill Industries, and they can provide you with job skill training and even help you in your search for employment if that's what you want to do. Do you have any questions so far?
No.
Okay.
Sounded good.
Yeah? All right, I'm glad to hear that. So, overall, if you're ever in a bind, if you're not feeling too well, maybe even depressed, any services that you may feel that you need or any crisis you're going to, United Way has an excellent 24-hour phone line. The number is really easy to remember. All you have to do is simply dial 211.
Okay.
What's that number?
211.
211, you got it. So if you need any information about services, housing, transportation help, medication, just give them a call, and they have about 2,000 resources just in the state of Florida, Central Florida, that they can provide to you to help you get the help that you need. Okay? Well, you're looking so much better. It was a pleasure meeting you.
Nice to meet you soon.
You take care of yourself. Be safe.
All right.
All right.